Now, the chief medical officers of all four UK nations have attempted to reassure people over the government's decision to delay second doses of the Pfizer vaccine. It's an attempt to double the number of people getting the first initial dose, which still offers a large degree of protection amid a soaring number of cases and hospital admissions and concerns about a potential future shortage of the vaccine too. Well, Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter, regular here, joins us now, as you see. Doctor, thanks for your time this evening. Shall we start with this, the questions that perhaps some people have about the idea of having an initial dose and then not getting the second dose in the 3 weeks they expected? Do they have anything to worry about?
No, I would like to reassure our viewers that the important item to address here is immunize as many people as possible, as fast as possible. So instead of, say, for example, immunizing 1 people fully with the 2 doses, if you immunize 2 million with 1 dose, you have got a bigger pool of people with some immunity, and that immunity prevents them from having severe illness. And in the middle of a rising number of cases, what we want to do is prevent people having severe disease. And eventually, we will catch up and give them the second dose as well. What we're trying to do is maximize coverage with the 1 dose.
Can we just move on to the provision of vaccines more broadly and actually whether we have the wherewithal to get up to the sort of 2 million a week figure that's been talked about? And there's a story today suggesting that some hotel chains and more of the private sector might be drawn into this process. We know already, for instance, the army have offered logistical support as well. How do we get the numbers of vaccinations and the people willing to administer the jabs up to the sufficient levels required?
So what we should do is, we are already doing it, which is train people who know how to do this. We've got a lot of NHS staff who can do this. But what we don't have as clinicians is that logistics experience. And I would very much welcome people in the logistics industry who can then set up a flow of people 24/7 in stadiums, in places where we can drive up to and be quickly processed and immunized flat out. The sooner we do it, the sooner we build up a layer of protection.
It's a difficult time of year, for obvious reasons, over the Christmas period to make definitive judgments about things that ordinarily we would do. And I'm thinking about that in the context of the daily case figures. We've had, for the 4th day consecutively now, new cases in excess of 50,000. Now, there's a way of reading that as a stabilisation, actually, of the growth in new cases, but it may be because of, lagging indicators about the reporting times over Christmas. We simply don't know. Are you hearing, anecdotally perhaps, of how capacity-wise clinicians and our hospitals are coping? I mean, there's a new focus on the Nightingale hospitals. There is a gathering sense that people have of a crisis point approaching.
Well, I talk to my clinician friends all across the country, and I do it deliberately because I want a picture of what's going on, their view. And they are all telling me, we are full, we are very busy. We are treating patients in theatres, in the corridors, in any place available in the hospital because the wards are full. So all my clinician friends across the country tell me they are very busy. Here in the southwest where I am, we have fewer cases. We are not absolutely full, but we are taking patients from elsewhere. So the indications are it really is tough times in hospitals, and especially so with this more infectious strain. We are generating more cases, and more cases means more patients.
I'm just going briefly back to the pandemic. I know you've been quite outspoken before about the necessity of reaching the hard-to-reach communities who may be more sceptical about the use of the vaccine. What is that message?
Well, the message is very clear. Vaccines save lives. These vaccines have been tried, they've tested, they've gone through their normal safety checks, and they are marvelous inventions which will really, really save lives. Be it the Pfizer, Moderna ones, be it the AstraZeneca, Oxford one, they are really good, safe things. And if I were anyone who was offered a vaccine, I would take it immediately.
Dr. Pankania, appreciate your time as ever. Thanks a lot.
Thank you.